According to the Cook County Department of Public Health, the leading cause of death in the Cook County area is due to cardiovascular disease or heart disease. In recent years, 33% of all deaths in the Cook County were due to cardiovascular diseases. Of those deaths due to cardiovascular disease, more than half were from coronary heart disease, followed by stroke, which is responsible for 17% of cardiovascular deaths. According to Mayo Clinic, cardiovascular disease is a buildup of plaque, which thickens and stiffens artery walls. This can lead to the blood flow being blocked in the areas where plaque is built up, blocking blood from getting to the organs and tissues it needs to go to. The main causes of cardiovascular disease are preventable and correctable problems, such as an unhealthy diet, lack of exercise, being overweight, and smoking. Symptoms of heart disease include chest pain, shortness of breath, pain, numbness, weakness, or coldness in your legs, or pain in the neck, jaw, throat, upper abdomen, or back. Some of the risk factors for cardiovascular disease include age, gender, family history, smoking, poor diet, obesity, and lack of physical activity. As your age increases, so does your risk for heart disease because as you age, there is more risk for damage or weakening of the arteries or heart muscles. Men are also more likely of getting heart disease. Your age and gender are risk factors that are out of your control. However, many other risk factors for heart disease are correctable actions in our everyday lives. For example, quitting smoking, improving your diet, increasing your physical activity in your everyday life are all changes that are in our control and will decrease our risk of getting heart disease. The treatment for cardiovascular disease is centered around lifestyle changes and medications. However, in many cases, lifestyle changes are enough, and medications are only used if lifestyle changes aren't enough on their own. These lifestyle changes include eating a low fat and low sodium diet, getting at least 30 minutes of moderate exercise on most days of the week, quitting smoking, and limiting alcohol consumption. According to We Plan 2015, created by the Cook County Department of Public Health, they propose strategies to help prevent and reduce the cardiovascular disease mortality and morbidity rate in Cook County. Some of the top strategies they list are implementing a social marketing campaign targeted at high risk groups for tobacco use, implementing opportunities for access to healthy foods, especially in areas without adequate access to fresh foods, and implementing local policies for access to safe places to play and exercise. I believe that programs for prevention and education about chronic diseases, including heart disease, should be centered around schools and young school-aged children. Children are the best people to target preventative programs towards because if you educate children about heart disease at a young age and show them the path to a healthy lifestyle, you are nipping these problems in the bud, preventing unhealthy lifestyles as adults. Although schools try and teach these things, I think these programs could be better and make learning about heart disease prevention more interactive for children. A school program for heart disease that I believe would have more impact on prevention would be made with the slogan, "Love your heart and your heart will love you back." The program can teach smoking prevention, what a healthy diet is, and creating more opportunity for healthy snacking in schools, and make competitions for the children involving physical activity. Heart disease is a problem in Cook County and has been for years. The Department of Public Health are working to create new programs aimed towards education and prevention for heart disease. But we can all do our part by making these changes in our lifestyle and decreasing our own chance of getting cardiovascular disease.